So now we're going to get into some of the more applicable stuff to folks in the medical community. Questions you can ask yourself as you're working with somebody as to what maybe they might be going through. Again, none of these are immediate red flags. Clearly, this is a trafficking survivor. Unfortunately, we don't have a silver bullet, but just some good stuff to look at. So if they're accompanied by somebody who seems controlling, and if that person insists on providing all the information to you, this could pertain to U.S. citizens, could also pertain to immigrants. But certainly with the immigrant population, we see this all the time. If they get brought in for any sort of medical treatment, there's always somebody who is either the trafficker or associated with the trafficker there with them, acting as an interpreter. And the trafficking victim will never actually say anything. It'll always be the interpreter answering all the questions. Was it a question or just? Okay. Can you see and detect any signs of physical abuse, chronic neglect? I'm going to get into that momentarily. Submissive and fearfulness. And we're talking more than just, I don't have documentation and I'm afraid of being caught. You can really tell when somebody has faced severe isolation and severe trauma and abuse, because they'll physically be shaking. They will be startled by pretty much any sound or any movement. Closed doors. They will not want to be in a closed door area for any period of time. All signs that there's something not right going on there. Do they have difficulty communicating? Again, language or cultural barriers. And do they have any form of identification? Most of the immigrant victims we work with will not have identification. Looking more at the U.S. citizen children, do they have excessive amounts of cash, numerous hotel keys? Are they a runaway or homeless youth? Are they lying about their age? And do you know that they're lying about their age? Very, very common. Signs of branding. Branding is a really popular form of control with pimps. They'll use different patterns of cigarette burns. They'll use tattoos. I've seen one that had a barcode across the back of the neck, and then the tattoo of slave underneath that. And then different gangs have different tattoos as well that they'll often tattoo onto the women that they're prostituting. Major inconsistencies in a person's story, similar to an overly consistent story. Lack of knowledge about community or your own whereabouts. Lots of new clothes, electronics, accessories. Are there substance abuse issues? If you have access to any different systems, can you find out, do they have multiple entries into multiple systems? With law enforcement, that's something that they very quickly use to identify commercially sexually exploited youth is, well, this person's been picked up by law enforcement in 3 different cities along the I-5 corridor, and there are reports from 3 different service providers who have provided services to them, and the FBI has a file on them. So there's something going on here. And then sexually transmitted infections, pregnancies, signs of botched abortions, very, very common with sex trafficking survivors. Communicating with victims. Above all else, you follow a do not harm model and a victim-centered approach when working with survivors of trafficking. And some communications with the patient may be better left to social service providers, but active listening, asking the right questions, can get you some important information from the victim that may be able to help them in the long run. Isolating the individual is very important. Again, most of the time, there's somebody associated with the trafficker. If not the trafficker themselves, they're with the person. And so it's really important to be able to get that person one-on-one and get them away from whoever came in with them. And in the medical profession, it can be as easy as, I have to run a test. It's a personal, it's a private test, and I need to work with this person separate. And we can call in an interpreter. That's not a problem. We don't need your services. Why don't you just wait right here? Talk to the individual in a safe, comfortable, and confidential environment. Strict confidentiality, of course, is really, really important to survivors who may be embarrassed, they may be ashamed, they may not have ever talked to tell you about what happened to them, and they may not really understand what's happening to them. Indirectly and sensitively ask questions. First of all, they have no idea what a trafficking victim is, so you certainly can't approach it from that angle. And they may not admit that they're a victim of anything. They may think this is just part of the normal process. When communicating with victims, essentially you're looking at 10 guiding principles for ethical interviews. Do no harm, know your subject and assess the risks of working with the subject. Prepare referral information. Don't make promises that you can't fulfill. That's something that can really cause some issues with survivors, is saying, we're going to take care of you, we're going to make this better, we're going to help you escape. Any promise like that that's left in any way unfulfilled is only going to further their distrust of the system that's supposed to support them. So you have to be really careful about what you say and how you work with survivors. Select and prepare interpreters and co-workers appropriately, particularly with regard to gender. If you're working with a female survivor of sex trafficking, she often is not going to want to be in the same room as a male. And again, that's not always possible, but whenever possible, having somebody of the same gender working with that person is going to make them a lot more comfortable, and it's going to allow them to discuss what happened to them in a way that's much more likely for them to actually say what's happening. Anonymity and confidentiality, informed consent. Listen and respect each person's assessment of their situation and the risks to their safety. Don't re-traumatize, which can be very, very challenging. Again, indirectly asking questions is a good way to get information out of folks, both about their medical history and what's happening to them medically, and also about how they ended up in this situation, as opposed to asking a question directly, which can be incredibly re-traumatizing, make them freeze up, and not provide you with any information. Be prepared for emergency intervention. Somebody may come into your care who was not brought to the emergency room, but was brought into a local clinic, and you're working at the clinic that day, and they need to be brought into the emergency room. So you have to be prepared to get that person transferred over to emergency care as soon as possible, and put the information collected to good use.
Do you have an example of how you might ask a question indirectly?
Sure. In fact, it's coming up here on one of these slides, I think. And there might be some in the handouts. If not, I have a list of them lying about as well. Well, here are some. So do you know where you are? Where are you from? How did you get here? Really basic questions. If they're talking about their work, you can ask, have you been receiving compensation for this work? Can you leave your job if you want to? When you're not working, can you come and go as you please? Have you been threatened with harm if you try and quit? Have people threatened your family? What are your living conditions like? Asking permission to eat and sleep and go to the bathroom. Locks on your doors and windows so you can't get out. You can ask just these kind of broader questions rather than getting at really what you think is going on with this person. And you'll probably get more information out of them that way than you would directly asking them about, well, you've got this terrible black eye, or you've got these bruises all over your back, or you're clearly having trouble breathing, tell me, what happened here. Asking the broader questions will often get more information and make the patient a lot more comfortable. In terms of trauma-informed care, patient-centered, human rights-based approaches, very, very important. Focus on empowering the patient through choice and through options. Again, trafficking victims have had all of their freedom taken away from them for an extended period of time. The second you give them choice and options and empower them to make decisions on their own, they're going to jump at the opportunity because it's just not something that they are familiar with anymore. Providing a detailed, clear, and concise information on client's condition, why the client is experiencing this condition. Very important. Remember, again, your role as a healthcare professional. Stay within that role, but build a relationship with the patient and listen to the information the patient volunteers to you. Again, active listening is going to be really, really important because you might be talking to them about why they're coughing, why they're having trouble breathing, and you can explain to them medically what's happening, but they might then be saying, well, it's because the situation in which I'm working, these are the conditions that we're in, there's dust flying around all the time, we're working, near insulation that's got fiberglass insulation and constantly causes us to itch, which is why I have this rash, and information like that can be really invaluable. Child victims require special consideration and special care. And again, I really barely touch on that because that's getting into a whole new area. And with all of this information, again, I encourage you to look at the manual that I passed around there. It's floating around somewhere. That's a 230-page document about best practices in caring for human trafficking victims within a medical setting. So barely scratching the surface here. Medical information in terms of the types of industries that we see trafficking happening in, the labor and exploitation health risks that are involved, and the health consequences as a result of that. We see construction, manufacturing, fishing and fisheries, agriculture, domestic servitude, mining, food processing, forestry, you name it, lots of different industries. And as you can see, a lot of these industries take place here in Oregon. We got a lot of this stuff going on. Specifically, I've worked with survivors from construction, agriculture, fishing, forestry, and domestic servitude, along with prostitution. All cases that I've personally seen. As a result of their situation, often you see things like poor ventilation, poor sanitation, poor nutrition, sleep deprivation, long hours, repetitive motion injuries as a result of what they're doing. They might be really poorly trained and indicate that to you. Chemical hazards, no personal protective equipment whatsoever, heat or cold stress, airborne contaminants, bacterial contaminants, all sorts of stuff. And then, of course, the health consequences of that, exhaustion, malnutrition, dehydration, repetitive motion syndromes and strains, heat stroke, hypothermia, accidental injuries, respiratory problems, GI infections, all of this stuff. Very, very common with labor trafficking.